Hi everybody, my name is Dustin Simmons. I'm an LPN to BSN student at Indiana State University, and this is my presentation on the elderly and healthcare. Before we get started, I'd like to take a second and ask you to pop on over to the pretest and just evaluate your knowledge on the subject before we go through. This is something that I deal with personally on a day-to-day basis at my job. I deal with the elderly patients that are facing these challenges every day and making that work out. So this is something that's always interested me and something that is very near and dear to me. These are the learning objectives that I would like everybody to walk away with. I'd like you all to be able to identify the challenges that the elderly face when seeking healthcare. I'd like you all to be able to identify the difficulties that these challenges place on the elderly when seeking healthcare. And I would also like you guys to identify the ways in which this newly developed 5G network can and will assist this population that's at risk. As nurses, a vast majority of our clientele are elderly. Um, Unfortunately, that's just the nature of the game with us. Uh, Now, when dealing with the elderly, especially in an outpatient setting, um, it can be rather challenging. The elderly often have very limited finances due to their fixed incomes. Most of them are retired. They're not necessarily working like they used to, so they don't have that disposable income to spend, uh, especially on the healthcare that they need. And even with insurance, even with Medicare, Medicaid, uh, private insurances that they may have, it's still very pricey for them to get the medications that they require and also the treatments that they need on top of the doctor's appointments to get those services. Um, Another thing that the elderly also face are often multiple medical problems that are very serious. So oftentimes they're not only seeing one doctor, they're seeing many doctors. They're seeing cardiologists, nephrologists, primary care, all for different reasons, which is also something that contributes to the financial strain on these folks. Um, Also, most of these folks have some form of physical impairment that hinders their mobility in some way, shape, or form. Either they have some medical problem that's chronic that impairs their mobility or impairs their ability to move as much as they used to, which again contributes and kind of feeds into their multiple medical problems and feeds into the amount of doctors that they need to see. And also because of their advanced age, many of them may not be able to drive for whatever reason, either due to age or their medical problems, or just their financial situation doesn't allow for them to have a car or truck or some sort of transportation to and from these doctor's appointments. And these all kind of feed into each other, which kind of creates a perfect storm and a perfect recipe for difficult access to healthcare. How this impacts their care specifically is, like we said, many of these patients see multiple doctors for different reasons. They're seeing, cardiologists for their heart, nephrologists for their kidney. They might be seeing heart failure for heart failure issues. Um, so all of these doctors require, different copays, different testing that needs to get done on top of the regularly scheduled appointments that they need to go to. Um, these multiple appointments and the management of their multiple disease processes gets expensive, very expensive, even with insurance. And because of some of their difficulties traveling and difficulties finding transportation, they're oftentimes reliant on either public transportation, family, friends, Lyft, Uber, cabs, whatever their means of travel is. They're often reliant on other people to get them to these appointments, which again kind of feeds into the financial strain that these folks feel. and also their difficulty ambulating creates difficulties even getting from the car, their mode of transportation, to the individual doctor's office or to the hospital. It just kind of is a self-repeating circle that just kind of feeds into itself, unfortunately. This means that a lot of the elderly that are requiring this kind of care won't be able to get it. Either A, for financial difficulties, or transportation issues. It also creates potentially serious issues with their known disease processes. Like if these folks can't get to doctor's appointments to get treatment, these disease processes often run unchecked and continue to worsen over time. And also, due to their states of health, oftentimes the people that they are relying on, who may also be elderly, face challenges when dealing with an unexpected incapacitation or unexpected change of condition, which all leads to very difficult access and management of healthcare. Fortunately, there is a bright spot in this new technologically advanced world. As technology advances, we are using those advances to assist us in caring for our patients. Actually, as recently as last year, they started developing 5G connectivity technology, which this is a solution that could potentially greatly impact the way that we treat our patients, the way we care for our patients. It has the potential to connect all providers regionally, statewide, and nationally, which would be a huge leap forward. And with that increased connectivity, it also is bringing connectivity to new areas and to often the elderly folks that may be living in either rural areas where they don't have easy access to healthcare, or care to these folks that have difficulty getting transportation or have increased mobility issues. So it's a very, very potent solution to some of our healthcare problems that we are facing, especially within this population. What this means for healthcare is it would give us a greater ability to conduct telephonic or internet-based healthcare visits. This would eliminate the difficulties with arranging transportation to and from appointments. This would minimize the impact that the physical disabilities and physical mobility problems that these folks tend to experience. It would minimize their effect because they would only have to go as far as their living room or their kitchen, wherever they are doing these visits. It's more cost effective, not only for the provider, but for the patient. And also it would allow for more organized and collaborative efforts among specialties. It could potentially mean that every provider could see treatment plans, notes, and any imaging that these providers have gotten, which would increase the patient's care. What this means for the patient is less dependence on transportation and less difficulty getting to these appointments via their physical mobility. It means less cost to the patient and increases the collaborative efforts among specialties, especially with these patients that do have multiple comorbidities. The elderly have multiple comorbidities that will impact their ability to effectively access healthcare for all the reasons that we have discussed. This technology is a way to potentially ease all of those burdens for the patient. Thank you everybody for listening. If you can just take a moment and go take the post test to see how well this course provided you information, it'd be greatly appreciated. Thank you.